This video has some recent updates, and of course I will provide some mnemonics to make it easily memorable, and please watch it until the end. So let's start with our first drug, that is tofersen. The FDA approved tofersen to treat the patient with amyloid of lateral sclerosis, that is ALS, associated mutation in the superoxide dismutase 1, that is SOD1 gene mutation. It is an antisense oligonucleotide that targets SOD1 mRNA to reduce the synthesis of SOD1 protein. Now break down the word tofersen. Too far from sense. Too far sense. That is antisense. Too far from sense. Antisense. So is a antisense oligonucleotide that targets production of the superoxide dismutase 1. Our next drug is lecanemab. So lecanemab is the brand name. That LE is coming from the lecanemab, and it is given in a treatment of early cognitive function dysfunction of Alzheimer's disease, and it decreases amyloid beta 2 production, and also is a humanized monoclonal antibody, that is EMAP. So FDA approved is for early Alzheimer's disease, and it is a second anti-amyloid drug following aducanumab. Our next drug is trofinetide, a first approved FDA approved drug for Rett syndrome. Peptide means tide. Tide means it is peptide, so will digest in the intestine, so given in injectable form. Insulin like, it is insulin like growth factor 1 analog. But in this case we have to remember as a mnemonic, trofinetide means tro means through oral, so route of administration is oral, and FI for first approved drug against Rett syndrome, the age more than 2 years or older. So trofinetide, also known as DEVA, it is first approved drug for treatment of Rett syndrome in children above 2 years or older.